Hi, I'm Dr. Charlie Schuster with Back to Health, and I'm going to talk today about proper sleeping. So many of our patients, when we talk about how to sleep, they don't really have an answer. If they don't know that they should know how to sleep. And when you're laying in bed all night, a couple things. One, your blood pools in muscles. So getting out of bed in the morning, you don't have blood carrying oxygen to your muscles. So it's important to get out of bed correctly. Not a bad idea to learn how to do this very methodically, and we're going to talk about how to get out of bed in the morning. So some of us, first of all, I ask if you're a stomach sleeper, because if you're a stomach sleeper, quite honestly, the chiropractor can only help you for a short period of time. There's no way we can help somebody with any kind of neck problem that sleeps on their stomach. It will eventually cause arthritis because it stretches the ligaments along the front side of the vertebrae and creates instability, and your body will stabilize that, eventually laying down salts, and we call it arthritis. Okay, so when somebody sleeps on their side, I always say, can you demonstrate? Because sometimes they think they're on their side when they do this. Okay, and that position again has the neck turned and the muscles shortened on one side for long periods of time. And your brain doesn't ever quit. It tries to bring your neck back to neutral, which means these muscles that rotate your neck the other way are going to work all night burning ATP, energy, while you sleep, and building up lactic acid while you sleep. So we really want you to focus on either sleeping on your side or your back. So we talk about when you sleep on your side, it's a good idea to have a pillow between your knees. So I'll demonstrate that. I don't actually have a pillow here, but it's good to have a little pillow between your knees, because otherwise, you can see here, these muscles are pulling, and over time, not only will they be tight, but it actually stretches the ligaments in the lower back and sacroiliac joint and pelvis. So it's good to have something between your knees to keep that relaxed in a neutral position. Also, if you would just do this one time, and that is snap a selfie of yourself when you're laying down. Your head should be in a straight line with your thorax or mid-back. So it's important that if you have a pillow that slightly has your head cocked up like this, that you change that pillow the way you can. Now you can take a towel, roll it up, put it in your pillow sheet to kind of take up some of the slack right here and get that into a neutral position. If you don't want to mess with that, cervical pillows can be good, but I'll tell you, they need to keep your head neutral. I don't care how much you pay for one. Okay, so that's an important concept. So laying on your back needs to become a habit when you sleep on your back of having something under your thighs. That way, again, you're not pulling on the pelvis while you sleep and creating stress in the lower back. So a pillow underneath your thighs, great idea. Also, the pillow under your neck should maybe have the same support that it does on your side, so that it keeps your body in a neutral position. So in other words, you don't want to sleep like this, because that has your spine in a compromised position, and all night you'll be uncomfortable. And so likewise, you wouldn't want to sleep with your head tucked, because again, your brain wants that spine not in this position, not in this position, but exactly in that position while you sleep. So going from your back to your side requires making sure you have your support under your neck, pillow between your knees. Now when you wake up in the morning, remember we talked about the blood being pooled in the muscles. Also, your discs will have been non-weight bearing all night, so they're going to have some fluid in them, and they're going to expand. So the spaces between the vertebrae are expanded a bit in the morning. That means the ligaments are going to be tight. So it's important that whatever position you're in the morning, that you just take a minute or two. Great reason to hit snooze. I'm not a big believer in alarm clocks, but here's the deal. If you'll sit on your back like this with your your legs supported, relieving the stress in your pelvis for just a minute and letting the muscles relax for just a couple of minutes before you get out of bed. That's a good way to be sure that you're not going to use some tightened muscles that are a result of sleeping slightly incorrectly during the night. Now, when you go to get up, you'll go to your side very carefully, and you want to just let your feet come off the bed at the same time you walk yourself up, and you'll notice there was no strain on my back. This may seem ridiculous, but starting your day off without a muscle spasm, even one you maybe aren't aware of, great idea. So you want to come out of bed using your legs, slightly arched lumbar spine, and then begin to walk. Now, as you get on your feet throughout the morning routine, your discs are going to compress a little bit, and your ligaments are going to relax, and your heart's going to start pumping blood to those muscles, and they'll be a lot more less likely to pull. So just wanted to talk a little bit about sleeping and getting out of bed. Very important to start your day off right.